We're just driving along here, Britt and I.
We are.
Oh, there's a bit of a bump on that right there. You guys are wondering, what on earth are these two doing? What I was trying to show everybody, and this has happened to all of you, I'm sure.
Yeah.
When you're driving along and there's a bump on the side of the road where you end up, the car tilts on its side, what do you do with your head? You then tilt the other way. Is that right?
Yeah, it feels right. Yeah.
Yeah, you tilt the other way. Yeah, so your eyes are level with the ground. So today we're talking about uneven hips, and it'll all make sense to you in a minute. I'm Dr. Lisa, this is Dr. Britt.
Hi guys.
And we're chiropractors at Errol Street Chiropractic. And a big problem that we see in our office, and it is so often missed, is a short leg. So we're going to talk about 3 signs that may indicate that this may be an issue with yourself, and especially if you're suffering with lower back pain and stiffness, then you might want to check these 3 signs really out. So the first one is really just checking the pelvis, so the pelvic height. So best to do this standing in front of the mirror, or you might want to, check somebody else out in the house.
Yeah.
So with hands kind of flat, pop them. Sorry,
I
Britt.
was too busy doing it. Sorry.
Actually, Britt, you do it. Pop it flat hands on the top of your pelvis.
Yeah, those crests. When you say put your hands on your hips, that's what you want to do it.
It's actually, that's actually your pelvis. So pop your hands there. So if they're nice and flat, then especially if you're standing in front of the mirror, is one hand higher than the other. So if you can really see that, then you may have a short leg on one side.
You can.
Let's just show you what happens as well. So before we go into the second and third thing, so if you've got one leg that's shorter, now what happens is that it will create an imbalance in the sacrum. Now the sacrum is this triangular bone here, guys, and that is what your spine sits on. It's the base, okay, your sacral base, okay? So if you've got a short leg, then what happens is that base now becomes what?
Uneven.
Yeah, it becomes uneven. So it's like your house being built on an uneven base. Okay, it's not going to end well. Okay, so uneven base, sacral base, means what with your spine? Like when we're in the car. Okay, what has your spine got to do to have your eyes level? It's got to somehow get its...
Yeah, it's going to tilt and shift.
Yeah, exactly. It's got to end up being level at that top part which is your eyes. So that could mean a bit of a tilt or a kink or perhaps a scoliosis in that there's more pressure on that low side, structures, tissues, joints, discs. There's going to be a lot of uneven wear. So a lot of those kind of symptoms can, not all the time, can be attributed to a structural short leg or a leg length deficiency, as we say. So you can check those hips. The second thing that we see in people, or people will describe to us once they realise that they've got a leg length deficiency, is that when they're sitting and their feet need to be on pedals, so that could be like a push bike or a motorbike. I actually had a patient who has a short leg that we discovered, and he was trail bike riding on the weekend, and he's like, or horse riding. What happens when you've got the stirrups or the pedals is that you then have to make, you've got to adjust to that. So you've got to compensate. That's the word I was looking for, Britt. And what do you do to compensate? You just create that little tilt in your pelvis even more, so your feet actually can touch the pedals or the stirrups. Okay, so people go, oh, that makes sense why I'm feeling a bit crooked on my bike. Yeah, guess you are crooked.
And that becomes very uncomfortable, especially if you're riding a bike for periods of time.
Yes, and he wasn't. I mean, apart from all the bumps and jumps and things, but the longer you're sitting like that, the more of a chance that that lower back can get aggravated after those kind of things. So riding a bike or all those things. So what's the third sign that you might have a short leg?
The third sign is, for a lot of people who have a short leg, their natural standing posture is to tilt one hip up and have one leg straight and then one knee bent. And that's just a natural posture that they go straight into, because it's that compensatory posture to help feel like they're nice and even because of that short leg. So yes,
I'll tend to keep the long leg bent at the knee, and then that will help that stability around the pelvis.
Feel like you're lengthening out a little bit.
Don't feel like you're standing all lopsided. So obviously, if you've got one of these three signs, so it could be, you feel that, you can see that one hip's a little bit higher than the other. You might have noticed things with, stirrups or pedals that you're sitting uneven, or, you tend to bend one leg. So if you've got, say, one of these signs, then look, you may not have a short leg. But if you find that you've got all three, then you more than likely do have a short leg. And so what do you do about it? Now, what we do in the office is, especially if the person's had that short leg for a long time, we may need to really be working on loosening up that spine, because often we will pop a heel lift under that short leg, and that will help to balance up that sacral base, which is what the spine sits on. So it depends on how severe that short leg is, and then we will adjust the spine, get things moving, and then add a heel lift to get things more balanced. But guys, if you're not sure, if you've got any questions, feel free to ask. Send us a message, give us a call. But if you do find that this might be you might want to get in touch with your local chiropractor and get them to. And the only way we're really going to know is by taking an X-ray. Okay, so that's the only way. And we do that with our expertise in chiropractic biophysics. They've got the best way of analysing for a short leg. X-ray needs to be taken in a special way, and then we'll analyse that properly. We don't just measure from one hip to the other. We actually have to take in a whole few factors into consideration when we're looking at measuring that properly. But anyway, find out from your local, preferably CBP chirobiophysics practitioner, if you think you might have a short leg. I think that's it for today.
I think we covered it all.
Beautiful. Well, thanks for listening, guys. I know
Thanks,
a few
guys.
of you are watching, and we'll see you all next week.
We'll see you then.
Thanks, Britt.
Thanks, Lisa. Bye,
Bye,
guys.